We shut down everything a couple of weeks ago, so we went to a complete WebEx educational program a couple of weeks ago throughout the entire university system. Even our group of attendings, we have a faculty meeting weekly, and we've done that by WebEx as well.
Okay.
The university system has created a pool of residents. Those who wish to can volunteer to take shifts in the medical ICU, either at the university or at Harborview. They've also created a tiered system across the whole graduate medical education system, where the surgical residents, they're going to have 3 of them per week, who may, if needed, they haven't been needed yet, would have mandatory rotations a week long in the medical ICU. So that's essentially what we've done across the whole system. In terms of seeing patients, we're trying to shelter both residents and fellows from seeing the COVID patients as much as possible. The hospital itself, across surgery as well as medicine, has taken to almost a doorway telemedicine, where we're having most of our conversations by phone with patients at the door. And then just going in for the critical things like a physical examination, or if there's any change or a wound check or something like that.
Okay. Yeah, I think we're pretty aligned with all of that. Steve, how about you guys?
Very similar. We're 100% virtual and web-based. In terms of our support staff, our office staff, we have about 20% come in every day. And the resident staff, we have about 50% come in every day. There's more of a pull now for our faculty to help in the adult hospital. And, you know, we've raised our hands and are on the pool now. The interesting point is the new ICU model. I sent that along as an attachment, but it's a kind of a new paradigm of taking, having the real great critical care people supervising these pyramidal teams that can, you know, handle 100 and some odd patients who are ventilated. And but that's, I guess, for a different topic. But we're completely web-based, and we're not. You know, it's interesting. They're trying to protect me because I'm an old man. You know, so I mean, you feel like, you know, you're in the battle, in the trenches, and then somebody says to you, well, "Why don't you stay out? You're a little old." So take it easy on the old guys, okay?
And for what it's worth, your pyramid, I took a look at it. It looks really tremendous, actually, and it will also, from what Dave was telling me, go up on the APSA website.
That's great.
And so it looks nice. I think it's useful for a lot of people. Mike, what education stuff? Same kind of paradigm?
Yeah, very similar. The medical students have been gone. The medical students actually set up a pool where they're helping. They set up a network to help the physicians run errands and do childcare and all these other out-of-hospital stuff, which is great. You can request a med student to come, like, pick up your dry cleaning and walk your dog.
That's amazing.
Which is amazing. And then for the residents, for the education, it's all gone web-based in the last 2 weeks. We've really limited the residents. The residents aren't doing things like pre-rounding or seeing consults. So the residents, if they get a consult, they do all the things to the EMR to figure it out. They'll give us a call, and we'll decide together who actually needs to go in the room and examine the patient. And we've just really trimmed everything back, exactly what the other guys were saying.
Okay. Samir, how about you guys?
We decreased how many pediatric surgery fellows are rounding at a given time. Like, we just alternate them like every 5 days. And then the number of general surgery residents have definitely been pulled back in terms of the number of people that we actually need, because there's no elective cases that have been happening. The ICU, though, our staffing has pretty much remained the same, just because congenital anomalies, traumas, cancers, like all of these just are occurring at the same frequencies. So we're not really seeing a huge dip in ICU census per se. And in fact, it may be growing.
Hey, what are you doing with your ICU your critical care fellows, are they cross covering with the adult units, especially out
No.
of need? No.
Not yet. I mean, we've been pretty busy as it is.